Hospitals in South Florida are asking the state for help. This week, 100 healthcare workers will head to Jackson Memorial Hospital in Miami so that it can increase its capacity. NBC News correspondent Catie Beck reports.
Well, Allison, hospitals here in Florida are really at the tipping point. We are learning that most Florida hospitals are operating around 80% capacity right now. In counties like Miami-Dade, where things are worse, they're operating closer to 90%. We know at least 9 hospitals in the Miami-Dade area have already reached capacity. So this is becoming a real struggle for health professionals to balance resources, to balance staffing concerns, and to find space, because these patients actually have to be treated in isolation, which means every bed that they use for them basically has to be away from other patients and away from possibly infecting other people. So this is a challenge that they are facing now as these numbers continue to rise and more patients come through the door. Doctors here say that this is really a symptom of bad behavior, that this is not a second wave or any part of a second wave. This is just people relaxing their standards and not following guidelines, not wearing their masks and not following social distancing. Doctors here say now it's presenting them with a challenge. When a patient walks through the door, how do we find a bed for them?
I think you have to remember that we do still have a lot of people out and about. They're not all COVID admits in ICUs. We've got other patients in there as well. Those hospitals do have some surge capacity for beds and for ventilators as well. I do worry a little bit about, are we going to have enough personnel if we really get into a serious situation, though?
Well, Allison, here in Miami-Dade County, the most populous county in the state and also hardest hit by COVID, just yesterday, the mayor here basically said we're going to be rolling back our reopening, putting more restrictions on restaurants and gyms, and that is to try and contain these numbers and try and avoid exactly what they're seeing now, crowding in hospitals. Allison?
A lot of firsts in Texas today. The state fair canceled for the first time since World War II. The number of new daily coronavirus cases topping 10,000 for the first time today. In Dallas, hospitalizations are at record highs. NBC News correspondent Garrett Hake is at the Texas Health Dallas Hospital. Garrett, a lot of not so great firsts today. We know there are more than 750 people in the hospital with COVID-19 in Dallas County right now. That is a record high. What's going on at Texas Health Dallas, where you are?
Yeah, Allison, the governor has been saying for months now that Texas has the hospital capacity to handle a major surge. Now those comments are being tested. That major surge is happening in real time. I talked to an ICU doctor from this hospital this morning who told me last week they might see 20 or 30 new patients with coronavirus each day. Now they're seeing 60 or 70, and a lot of those folks are sick enough that they need to be admitted to the ICU. And I should add that this is one of the smaller hospitals dealing with coronavirus in the greater Dallas area. So that just tells you the scope of the problem here. And here, they are less worried about running out of bed space or even ventilators. The technology has caught up to the moment to a certain degree, but more concerned about the demands on their staff. Doctors, nurses, respiratory therapists are human beings who can only work so hard for so long. And that's where the strain is going to be as this surge continues here.
Garrett, doctors there are asking recovered COVID-19 patients for help. What kind of help do they need here?
Yeah, so I interviewed a doctor named Gary Weinstein this morning who told me that early on in this original outbreak of the pandemic here, he successfully treated a patient for whom nothing else was working with convalescent plasma. That is the plasma from donors of other folks who have recovered from COVID-19. He sees that as a potential game changer in helping other people recover. Here's what he told me about this need today.
We've been using convalescent plasma routinely since it's become available. And I would urge everyone who has survived the disease and recovered to donate convalescent plasma, because as the number of patients who have the disease and get ill rise, we need more and more convalescent plasma to treat those patients to help cure them.
Allison, interestingly enough, this is 19th century technology, the idea of treating with convalescent plasma. It's still being studied. It's still being looked at by the CDC and by others. But again, at this point, amazingly, several months into this pandemic, doctors are still sort of taking the approach sometimes of we're going to try everything that may be available to us to find something that could work to treat those patients who are most acutely ill.
Garrett, we have seen long lines for testing all over the country and stories about people waiting a week or longer to get their results back. What is the testing situation like in Dallas County?
Yeah, it's bad, and it's been bad. It's frustrating here in the county because this has been a recurring issue. It's not so much that it's hard to get a test, but reliably getting your results back in a time frame that could be useful is near impossible. There is such a backlog at the labs. There's a lack of the reagents, the chemicals that are used to actually conduct these tests, that someone might go in to get a test and not get their results back for more than a week. Now, from a contact tracing perspective, that makes that test result effectively useless. People are not going to be able to keep track of everyone who they came into contact for over that week. And a lot of times people take the test and with lacking a result, or perhaps they're asymptomatic, they go back to work or they go back to being around other people, thus continuing to silently spread the virus. It remains a huge issue in the state of Texas, which has consistently performed in the bottom 10 of all states in terms of testing per capita of their population. Something the state's going to have to get a handle on, or else you're essentially flying blind fighting this virus.
Garrett Hake in Dallas County, thank you so much.
You bet.
The White House Coronavirus Task Force getting back to the basics today, asking Americans in coronavirus hotspots to wear masks, avoid big groups, and stay home.
Is really asking the American people in those counties and in those states to not only use the face coverings, not going to bars, not going to indoor dining, but really not gathering in homes either, and decreasing those gatherings back down to our phase 1 recommendation, which was 10 or less.
NBC News medical correspondent Dr. John Torres joins me now. And Dr. John, it's been a while since we had a briefing from the Coronavirus Task Force. Dr. Birx recommending people in hotspots go back to phase 1 guidelines. What do you make of that?
Well, I think she is right in what she's talking about, that we need to get back to these phase 1 requirements in hotspots around the country, because we're starting to see these spikes turn into outbreaks, which is something none of us would hope would happen. And what she's talking about is the things that we know are spreading coronavirus, and that's inside in these situations, bars, restaurants, and the gatherings, especially gatherings above 10, and the family gatherings, which is a big thing that Governor Newsom in California actually addressed, saying that he thinks that's where a lot of the different hotspots started cropping up in these family gatherings. And the big concern, though, is trying to make this more of a mandate across the country, because if we can start making this a mandate across the country, especially the masks, then we wouldn't have to worry about it spreading quite as much. And so hopefully that turn will start coming up pretty soon, because it's good getting it in the hotspots, but you need to start looking at getting in other areas too before they become hotspots, Allison.
Dr. John, let's talk about the kids going back to school. Today's briefing really focused on reopening schools. American pediatricians say it is important for kids to get back to in-person learning. The CDC put out some guidelines for how to do that safely. What do schools need to do? What do you think they should be considering when they make these decisions and when they're trying to keep kids safe?
And I think the big concerning thing right now is kind of the disconnect in the communication, because on one hand, you're hearing, which I agree with the American Academy of Pediatrics saying, the kids need to get back to school because they need that educational development. They need that social development. Their families need the ability to go back to work. All these different factors need to be in place so kids can go back to school. It's important for them. But at the same time, the American Academy of Pediatrics in their statement said, we need to do this judiciously. We need to make sure we have that 6-foot distancing, because although kids don't seem to get it as much, don't seem to spread it as much, they still can. And the staff in particular could be at risk. We need to worry about them as well. The concerning thing comes in when you hear from the administration saying that kids need to go to school 5 days a week, all students. You can't 6-foot distance in current classrooms if you have all students all day long. And so that's a bit of a disconnect there. So what Dr. Fauci had said about a month or two ago is that when it comes time for school, definitely get kids back to school, but we need to be very creative in how we do that. And it could be kids go for a few days, one group, the next group goes for a few other days, and they do remote learning. Something to make sure that they social distance, something to make sure they wear masks if they can't social distance. But as you know, you can't wear a mask all day long, and students in particular won't be able to do that. So we need to think outside the box here, Allison.
Dr. John, what about that inflammatory disease that we had seen in children? Initially, we thought that that was rare. The task force still characterized it that way today. Have we learned any more about that condition?
So it is still rare. It's the MISC, the multi-system inflammatory syndrome in children, and there's only been a few hundred having it. But the concern is this usually happens about 6 weeks after the peak in cases. And so we're still only within a couple weeks of the cases. They haven't even peaked yet. So start looking a month from now to see what's going to happen. I think we're going to get more of these cases, hopefully not a whole lot more, and hopefully it still stays rare, Allison.
Dr. John, 6 months in, we are still learning about what this virus does to the body. A recent study warned that the coronavirus can cause brain damage. Can you tell us more about what that study found and some of the concerns here?
Right. What the study found is that the long-term implications, the long-term results of coronavirus are a little worse than we thought they were, especially for people who happen to get the brain issues, the brain inflammation. Now, one of the things you have to remember is early on we found out that people were having a lack of smell and a lack of taste. The reason that's happening is because the virus is getting up into the nerves, the top of the nose, just below the brain, and they're affecting the nerves there. They're getting into them. If they can get there, they can get into the brain. They can cause this acute disseminated encephalomyelitis you're talking about here, which is basically a brain inflammation. It's that inflammation that can cause those long-term consequences. And so this can happen at any age. And the concerning thing is, especially with the young adults that are going out and not too concerned about coronavirus, it's not happening to all of them, but it can happen to any of them. And I think that's the thing that we all need to be concerned about, Allison.
Dr. John, we keep saying it, but we keep learning more and more about this virus every day. Thank you so much for getting us up to speed.
You bet.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.